Everywhere we turn, preventive health advice seems to be waiting for us. From articles and social media to schools and clinics, we're constantly told what to eat, how to exercise, and which habits to avoid. The intention behind all this guidance is to protect us, not to pressure us. However, when advice is delivered nonstop and changes frequently, it can feel more overwhelming than empowering. Many people find themselves confused or even anxious, unsure which recommendations to follow. This constant presence of health advice sets the stage for why so many feel lost in a sea of information. As we move forward, let's explore why this confusion happens and what lies beneath the surface of these ever-changing messages. Health science is always evolving. New studies refine what we thought we knew, and recommendations shift as evidence improves. But the way this information is communicated to the public often lags behind. The details, uncertainties, and limitations that scientists discuss are often lost in translation, leaving us with simplified conclusions and little context. This gap between scientific progress and public understanding can make advice seem inconsistent or even contradictory. For example, foods once labeled as harmful may later be considered beneficial, or screening guidelines might change unexpectedly. Without clear explanations, these changes can look like guesswork, which naturally erodes trust. It's important to recognize that these shifts are signs of learning, not confusion. Much of the confusion around preventive health advice comes from how it's presented in the media. Headlines and posts often favor urgency over nuance, turning gradual benefits into dramatic warnings. This approach can make every recommendation feel critical, leading to fatigue and disengagement. On top of that, preventive advice is built on the idea of reducing risk, not guaranteeing outcomes. Risk is a tricky concept. Without proper context, people may overestimate dangers or ignore guidance altogether. Health literacy also plays a role, as not everyone understands terms like inflammation or cholesterol. When advice is both simplified and assumes background knowledge, it can feel abstract or contradictory, making it even harder to know what to do. Today, we hear a lot about personalized prevention, advice tailored to our unique needs. Yet most people still receive broad, one-size-fits-all recommendations. When it's not clear why some advice applies to certain people and not others, uncertainty grows. Meanwhile, new guidance often arrives before the public has had a chance to process the last update. Trust, however, takes time to build. When information moves faster than understanding, even the best science can feel unreliable. The key is not just to deliver instructions, but to help people understand the reasoning behind them. Education, not just direction, is what empowers people to make informed choices and reduces the anxiety that comes with uncertainty. Ultimately, preventive health advice is advancing faster than public understanding can keep up. The confusion we feel is not a result of bad science, but of rushed and sometimes incomplete communication. Prevention is most effective when people understand the reasons behind the guidance, not just the rules themselves. When education is prioritized, people gain agency and confidence, and uncertainty becomes less intimidating. As we wrap up, remember that the goal is not to keep up with every new headline, but to seek understanding and context. When guidance and understanding move together, prevention truly works. Thank you for joining this discussion on why preventive health advice can feel so confusing. Remember, the journey to better health is not about chasing every new recommendation, but about understanding the reasons behind them. Stay curious, seek context, and take care of your health with confidence. I'll see you in the next video.